about the situation where you're not exactly certain it's a stroke? I remember I saw a patient once. I got a call from an outlying hospital about someone who was 35 years old, and they presented with weakness and numbness on one side of the body, and they weren't moving it at all. They really had no significant stroke risk factors, and what clued me in was the vital signs were completely normal, the pulse and the blood pressure. So they called me whether they should give TPA, and essentially I suggested that they did because there was no reason not to give TPA. But when the patient actually was then transferred to our institution, it turned out that it was a conversion disorder, and the MR imaging was completely normal, and all the symptoms resolved in 24 hours. So the reason I'm bringing this situation up is sometimes we really don't know if a patient is having a stroke, especially if we get a call from an outside hospital. What are the risks or benefits of giving TPA in a setting where you're not exactly certain it is a stroke?
Yeah, I'm really glad you brought that up because the reality is we have to make some really tough decisions acutely without all our information for IV TPA. That one is actually, in some ways, the good news is that the risk of TPA is very low in stroke mimics. Bottom line is the hemorrhagic transformation rates are related to having, dying, leaky brain vessels, and if there isn't an injury to the brain, that patient is much less likely to bleed. So the case series out there suggest that the risk of intracranial hemorrhage after IV TPA is extremely low, less than 1%. And that's not just case series with IV TPA for stroke mimics, but it's also been shown by looking at the cardiac literature of giving IV TPA to non-stroke patients. So with that in mind, I would err towards treating when you're not sure. I certainly don't want to expose a patient to a risk if I think this is a clear-cut conversion disorder, but we know as neurologists that there are a lot of gray areas, and so I would err towards treating.
Now, what about patients